What is love? Well, मतलब कैसे, मतलब if you want my answer from brain, so that is a game of neurotransmitters. It's a game of neurotransmitters. So whenever we feel attracted towards someone, right? So that is actually not love, right? It is just like infatuation. And then we give a nice name to that. Because some feelings they develop, it takes years. It takes years. So if anything is like burden on you now, बड़ा blunt बोल रहा हूँ, if anyone is, girl or boy, the male or female, doesn't matter. But at any point, if it looks like burden, offload it. There is no harm in it. Because see, your journey is not small. Your journey is like from today, minimum 10 years, right? This is minimum. So that's what you, if your dream is, and if you want to become super specialist, so add 2 more years. And this is when through and through, you are going without any obstacle. That is ek bhi gulli nahi mari. So if you consider yourself right now, if you are plus or minus like 20 years, so it will be about 32, 33 years. Kam nahi hai. Then rest of your life is would be absolutely wonderful because koi doctor aaj tak bhukha nahi mara. You need to work hard. So be selfish. Right? And when I say be selfish, so it is not from that intention, but give importance to yourself first. बस इतने में सब आ गया. ठीक है, इतने में सब आ गया. इतने में आपकी ईमेल का आंसर भी आ गया. So do care for everyone, but nothing at your cost. I learned it in a very harsh way and very hard way after losing so much. Right? कभी बताऊंगा. And at a very late stage of life. And at that point, you get shattered. You find it difficult to even withstand the situation. So I don't want that any one of you should be suffering from any of such things. Okay? So that day we'll be talking about, जब extra like session रखेंगे ना, तब we'll be talking about it. I'll tell you everything. No worries. You are like family members. कोई problem नहीं. Reason? You learn something from it. और वो चीज repeat मत करो. चलो, it's time. Right? It's time. 3 minutes past 10 and we start. So here it is. This is our plan for today. We'll be learning about heart and the vascular system, adult vascular system. That is post-birth. When everything is settled, that's what we are discussing today. Fetal circulation, it is a completely different ballgame. So we'll be learning it next time, right? Because once this concept is clear, the rest becomes much more easier. Over here, we'll be talking about the systemic circulation, right? Systemic circulation in which we'll be talking about that how the blood reaches to brain, lungs, liver, right? Lungs, then upper limb, lower limb, thorax, abdomen, everything. But at the same time, we'll also be learning about one system, what is called as the portosystemic circulation. So here, how the liver is different. What really happens when the blood goes to the liver and why that system is so important, because so many conditions, they're based on that. So we'll be learning both the things. And then I'll show you some examples of DSA, digital subtraction angiography. It is a nice concept. So I put the images also. So how exactly it is done, that's what we'll see, right? So let's start with apna simple heart, 4-chambered heart, right? Right atrium, right ventricle, left atrium, left ventricle, and these are the two valves. These two valves, mitral, which is a bicuspid valve. So it will look like this, Bi means two. Cusp means cup. So it will look like two cups, right? So bicuspid valve. Valve means something which is allowing the blood or any of the fluid or any of the structure to pass only in one direction. So that is what is called as the valve. Whether it is a valve into your tire tube, right? So in which the air is allowed to go in, but it is not allowed to come out. So that is the valve. One unidirectional flow, technically speaking, right? So this is mitral. Then this one, when we say it is
Tries to.
tricuspid, right? So name itself is telling that this valve, the structure of this valve should be something like this, and it is exactly like this. There are three cusps, right? So right atrium, right ventricle, left atrium, left ventricle. From here, it goes the aorta, and from aorta, the blood goes into the entire body. We are right now just like the body, right? It goes to the entire body. What it does, it supplies the oxygen. It gives oxygen. This is to remember, right? Because once I did this blunder, right, that right side and left side. So left LEFT, तब से ये shortcut निकाली थी LEFT. So that is PURE, pure, less alphabets, oxygen, less alphabets, RIGST, more alphabets. So that's why impure, more alphabets, that's why CO2, right? So that means the right chamber is having impure blood. Impure, when we say there is nothing like pure or impure, but when we say impure, that means it is having carbon dioxide. When we say pure, that means it is having oxygen. Right? So that's how things they really go. And from body, body would utilize this oxygen. Right? So it will blood will be going to those tissues. Tissues they survive on oxygen. So oxygen is taken in, carbon dioxide is released out. Right? How it does? It is because these arteries they divide, and finally they to small arteries to finally it goes to the arterioles to capillaries. So these capillaries they are the single cell layer, right? Capillaries are that thin. There is a single layer of cells. So the diffusion, oxygen comes out, carbon dioxide goes in, gets dissolved into the blood, right? And that hemoglobin would carry it, and all the way, this thing will be carried by veins, right? Arteries means something which is going out. That's why we say it is artery. Things which are going into the heart, we call it veins. So here also, these are the capillaries. They unite together to form small venules. Venules, they combine together to form tributaries, right? Nadi jo hoti hai, right? Nadi, right? River. The water is flowing in this direction. So that's why they say these are all tributaries. Tributaries, they unite and that river becomes bigger, 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 bigger. Same thing over here, right? These tributaries, they will unite. They are like small veins. Finally, they'll become a big vein, that vein, which is called as the vena cava, right? Big vein. Now, there are two. One is superior vena cava, and second is inferior vena cava. Whether it is superior vena cava or inferior vena cava, both of them, they would open in right atrium. Right? Superior vena cava, we'll see the formation of this entire superior vena cava, so how it forms. So from the blood which is coming from brain and head and neck, right? So that is coming via superior vena cava. And for the inferior vena cava, it comes from below, right? So upper limb, head and neck and brain, superior. Inferior is when it comes from the lower limb, abdomen, pelvis, and thorax. So that lands into the right atrium. So finally, right atrium is reached. Right atrium, which we now say that it will be having carbon dioxide, right, collected from the entire body. That blood is pushed into the right ventricle. From right ventricle, what goes out? It should be sent to whom? It should be sent to only one organ,
Mm,
and that is lungs. That's right,
lungs.
lungs. So lungs would do the reverse process. When we breathe, we take the oxygen in. So lung is ready with the oxygen. So lungs would give oxygen and will absorb the carbon dioxide. So when we breathe out, this carbon dioxide is thrown out, and then this pure blood, that means it is having oxygen, that is carried to the left atrium. Now the artery. right? Because this is going out. This is going out. So this artery, it should be given some name. As it is lungs, anything associated with the respiratory. So we now call it as
Pulmonary.
Pulmonary artery or vein,
Artery.
right? Because it is going out. That's why this is the pulmonary artery, which was the exception. It is carrying carbon dioxide, right? And the vein, which is carrying blood to the heart, so that would be the pulmonary
Vein.
vein. That's right. Now we'll make a small change. This pulmonary artery, right? It is artery, but because it is very big, so it would be injustice to call it artery, right? उसको थोड़ा respect देके, we'll just call it pulmonary trunk. So now we can easily differentiate between pulmonary trunk, right? Because it is big, and then it divides. That is in the form of left pulmonary artery and the right pulmonary artery, because it will be going to both the lungs, right? We'll have a look at it, but this is in nutshell because it has to go into both the lungs, right? So pulmonary trunk is the big base which is coming out, and then it divides. So obviously we can just think of that its shape could be like this, correct? So this is what is called as the pulmonary trunk, and then we have got the right pulmonary artery, and we have got the left pulmonary artery. Remembering these things will make you understand very easily about the congenital things. Suffering is necessary. ठीक है. I am supposed to do some experiment कि यार potassium cyanide जो है ना, which is the deadliest poison, उसका taste क्या है? I wanted to do some experiment. So as such, I was requiring some bakra. So Kanish, मैं आपको सीधा एड्रेस ही दे दूंगा, आप आ जाना घर पे. क्या दिमाग खराब करते हो? क्यों? There are 1,000 things in the world. Right? क्यों दुखी होना है? Suffering is not at all necessary. Right? बुरा लगे तो बुरा. But when you try to do this thing ना, अरे सॉरी क्यों बोलता है यार? सॉरी मत बोलो. दिमाग में बिठा लो. You are important. No sufferings. No more sufferings. है ना? शाबाश. मतलब जो कहते हैं ना कि why to reinvent the wheel? जब कोई बोल रहा है कि यार मैं दुखी हुआ तो मैं कम दुखी नहीं हुआ. जस्ट एक लाइन में बताऊं, मतलब आप लिख रहे हैं इसलिए मैं बताता हूँ. Someone who has taken lunch or dinner, those two guys, right? So called जिगरी दोस्त, घर पे कम से कम 1,000 बार खाना खाया होगा. कम नहीं बोल रहा, मतलब this is 1,000 times, right? Minimum 1,000 times in 10 years. They cheated in such a royal way. My entire savings, all gold, all stocks, including this car, I lost everything. Everything. And there was no one next to me. कोई नहीं. All so-called, मतलब relatives गिनो, ये गिनो, जो गिनो, मतलब जो पहले बोलते थे अरे सर आपका तो क्या, आप कभी भी मैं पैसा रख जाता हूँ कि आप तो बैंक हो. That's what used to happen. And there was a day, right? I still remember the date, but I got that photo also. When I went to that mandir, because वहां पे थोड़े कम पैसे में खिलाते थे, and I was, उसमें भी 5 रुपया कम था मेरे पास. मैंने कहा नहीं, I don't want. किसी ने बोला, there was some girl, she said कि अरे मैं दे देती हूँ. मैंने कहा नहीं. मैंने कहा मेरी आदत मत खराब करो. It is like जितना है उतने में खाएंगे. Yes, there were few days कि I just drank water, and that is at a very late stage of life. मतलब सब कुछ, I lost everything. There was no hope. But then worked hard, 20 hours a day, and got back everything. But सबसे बढ़िया चीज, पहले दिन के 100 फोन आते थे, 100 phones. अब दिन के 3 फोन आते हैं, 2 3, बट दे आर फ्रॉम दोज पीपल कि हु आर लाइक गोल्ड। मुझे पता है कि किसी से पैसे नहीं लिए थे, किसी से नहीं लिए थे, बट इट वॉज टफ। बट दोज पीपल, दे, अभी तो क्या किसी को बताया नहीं है, नाउ थिंग्स आर गुड, सो पीपल आर स्टिल अंडर इम्प्रेशन कि यार इससे दूर रहो। सो लाइफ इज गुड, बहुत टाइम मिलता है। सो दैट्स
If you
व्हाई कई
don't
बार
mind,
आपने
can
देखा
you
होगा, मैं
just
आपको ईमेल भी लिखता हूँ तो आराम से लिखता हूँ, इट टेक्स टाइम। मतलब इवन हाफ एन आवर, मस्ट हैव रियलाइज कुछ ईमेल जो है हाफ एन आवर, बट दैट्स व्हाट आई से कि बस यू गाइज आर नाउ लाइक माय फैमिली। बाकी तो आई डोंट ट्रस्ट अदर्स। आई डिलीटेड मोर देन 800 नंबर्स यार, इससे ज्यादा क्या बोलूं। 800 नंबर्स, 800 नंबर डिलीट मार दिए, नहीं चाहिए, यूजलेस पीपल। सो व्हेन आई रीड योर ईमेल्स, तो सच तो यार आपका मेरा क्या रिश्ता, मतलब वी हैव नॉट इवन मेट, है ना। जस्ट इट इज लाइक टोटल मारो तो वी हैव टॉक्ड विद ईच अदर फॉर फ्यू आवर्स। और ये लोग 1000 बार था, मतलब माई क्रेडिट कार्ड उनके जोमेटो से कनेक्टेड रहता था, एंड दे यूज टू ऑर्डर एंड देन दे जस्ट आस्क के जरा ओटीपी देना, एंड विदाउट थिंकिंग आई यूज टू गिव ओटीपी। पता भी नहीं होता था कि कितने का पिज्जा विज्जा मंगाया है। दोस पर्सन चीटेड। अमाउंट, दोस्त आप पागल हो जाओ, सुन के पागल हो जाओ। ठीक है। सब
बाप रे.
दे विल ग्रो।
Sir, what happened?
मत पूछो। इट इज, मैंने उनको सिर्फ इतना ही बोला था कि दोस्त ये जो किया ना, मैंने कहा ठीक है, आज के बाद आई वोंट बी मेकिंग एनी फ्रेंड्स, कुछ नहीं। लिटरली आई सेड कि ये मैं किसी को बोलूंगा, पीपल विल स्टॉप डूइंग द फ्रेंडशिप। मैंने कहा इतनी लालच, बट यस। हाँ बस जो, मतलब आप लोग काफी कुछ लिख रहे हैं। हाँ, आई एक्सप्लेन द लंग्स अगेन, आई मीन जस्ट या, यस यस यस। कर्मा, पता नहीं यार, कर्मा के बारे में मत मत, पता नहीं। दे आर लाइक BMW घुमा रहे हैं। देवर टेलिंग दैट कि बिकॉज आपके पास पैसा नहीं है तो माई स्कॉर्पियो, राइट, विच इज विद फिटेड विद, I love music with 8 speaker systems and everything with very good woofer, 30,000 में मांग रहे थे, 30,000, द स्कॉर्पियो 4WD, एंड हाँ 30,000 रुपए, 30,000 रुपए में तो बाइक नहीं आती, सिचुएशन
सेकेंड
वाज,
हैंड बाइक भी नहीं आती.
सेकंड हैंड बाइक भी नहीं आती, बट दैट इज व्हाट हैपेंड। सो यस पायल, वेरी ट्रू। ये जो आपने लिखा ना, वेरी राइट, वी शुड नेवर ट्रस्ट एनीवन ब्लाइंडली, पर नहीं, वो तब दिमाग में नहीं आया कि कैन समवन डू इतनी। हफ्जा आपने जो लिखे, मतलब उसका नहीं, आई लिव अलोन, सो इसीलिए, इसीलिए किसी ने कोई बोला नहीं और कुछ नहीं। जो जो सो कॉल्ड रिलेटिव्स, वो तो ऐसे दूर हो गए जब सबको पता चला। सो वही है, मतलब पीपल, मतलब किसी को हैप्पी बर्थडे के लिए फोन करो ना, तो वो उनका रिप्लाई क्या, बोलो ना हैप्पी बर्थडे। हाँ और कुछ था, अच्छा मैं अभी बिजी हूँ, बाद में फोन कर दो, काट।
सर टेंशन मतलब सर, हम आपकी फैमिली है, हम आपके साथ है।
बिल्कुल बिल्कुल, जरा भी टेंशन नहीं, एब्सोल्युटली नो टेंशन एट ऑल। बट ये क्या है कि these were like very very big lessons, very big lessons. अच्छा, आई वॉज प्लानिंग समथिंग, चलो अभी बता दो पहले से AI, right? It is say the speed at which it is developing, it is at amazing levels. So I have designed a course, right? That would be for about, say, that would be minimum 11 lectures. But how to utilize? I don't want that you start programming anything. And that also, it is not chat GPT के उसके अंदर लिखा नहीं. That is not AI. That is not even 0.1%. What I really want is that how can you really utilize AI into your day-to-day life, right? In your day-to-day life. And in that day-to-day life, not you are using the AI tools, but at the same time, they take you to the next level so that you become a better doctor. So from the medical perspective, from your daily perspective, I'm planning, I have prepared, right? Only some portion is left out, but I'm trying to plan one series on this, right? One complete series on this, and it will be comprising of about not less than 10, 11 to minimum. ज़्यादा भी होंगे, right? And I was thinking कि इसको मैं paid करने वाला हूँ. You know the payment मतलब कितना होगा per student? It would be say 250 rupees.
सर इतना कम मत लो।
नहीं नहीं, it's fine. मतलब ये 250 भी क्यों, right? It's like say 250 इसलिए that honestly it happens like when anything given free ना, बिल्कुल free होता है ना, तो people
उसकी
don't
वैल्यू नहीं रहती।
कदर नहीं होती उसकी।
क्या होगा ना, तो कम से कम I'll be able to pressurize on you कि किया किया homework किया. So that's why मतलब अपने मेरे दिमाग में I have planned मतलब in these 2 days that's what I've done. One, this AI, right? And none of these series will be costing more than 250 or 300 rupees. मतलब वो 10 दिन चले, 11 दिन चले, 15 दिन चले, 30 दिन चले, राइट? कोई लिमिट नहीं. मतलब इसके अंदर ये तो 11 तो मैंने पॉइंट्स डिफाइन किए हैं इन केस इफ इट हैपेंस लाइक से और कुछ हुआ, राइट? आई कम अक्रॉस मोर टूल्स, मोर so those agents, they are called as the agents, AI agents. So no problem, I'll keep on teaching you, and plus I'll be giving you some very good tools, right? उसका भी कोई चार्ज नहीं, everything. Otherwise what happens कि वो इकट्ठा करने में it will cost your time. So this another thing which is really vital. इसके लिए इतनी emails हैं पर I can't discuss it right now. For relationship, this is for male. ये मेल्स के लिए अलग, and same topic but for females it is different. It's not so that they can't say attend, so females can't have attend this and males can't attend this, but this is important from that perspective कि जो मैं बोलूं कि मेल्स के लिए कि यार पागल मत बनना, राइट? और फीमेल्स के लिए कि आपको मतलब उल्लू बनाने वाले बहुत बैठे हैं, especially आपके close circle में, they take advantage, right? What I'm talking about is, let me use the word molesting. It is very common, and simply because females either वो मतलब because of their shy nature या बोलती नहीं है या बोल नहीं सकती, इस केस में मतलब उनको they suffer from that mental trauma, and when that mental trauma, I know, don't send any messages, मुझे पता है, right? I stop messaging. Yeah. No, I won't be taking anyone's name, but what I'm telling in nutshell, don't send any message. Right? Email भेजना, पर मुझे पता है आपने मैसेज ऑलरेडी भेजे हुए. You need to know certain things. And what are those? For females, there are 5 what is called as the red flags. 5 red flags. Red flag मतलब जिंदगी में, मतलब अभी नहीं, अभी आप 18-19 साल की हैं, आप 25 साल की हो, 30 साल की. These are the 5 red flags. मतलब these will be very explosive sessions, very explosive. मतलब I won't be keeping any limit on that, but वो जरूरी है आपको कहना. तो those 5 red flags कि अगर जो आपने ये ध्यान नहीं दिया तो it can really turn into criminal things, right? And mostly females they suffer. So अभी से this came in my mind after reading your emails. For males ऐसा मत सोचो कि मतलब all females are like that, but you need what is your responsibility as a male. So here in both the cases, if you just understand what is your responsibility, whether you are a boy or a girl, right? So then the relations, they will be much sweeter and better and long term as compared to your short term things. फर्क क्या पड़ेगा इससे, राइट? फर्क ये पड़ेगा कि
Better human.
अरे ह्यूमन छोड़ो, आपके करियर में यू विल बी रीचिंग टू सच हाइट्स.
Okay. So it won't be affecting.
It in fact it would be a wonderful support, but वो ढूंढना, राइट, वो ढूंढना, दैट इज नॉट इजी. सो इट्स नॉट सो कि चलो बैचमेट से उनसे बात करना बंद कर दो, नहीं अभी मैं नहीं, एवरीथिंग इज फाइन, बट देन ये बॉर्डर, आई एम हियर, बस इससे आगे किसी को नहीं बढ़ने देना, राइट? व्हेन यू से मतलब दिस इज हियर इज यू, दिस इज यू, ये आपका कोर इनर सर्कल हुआ, बस बाकी के सब यहाँ पे है. इसके अंदर जिसको एंट्री मिलेगी तो दे विल बी वेरी 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 रेयर, वेरी रेयर. And then because they have to really pass through that acid test. It is not so that entry into this circle is easy. No, they have to pass through that acid test. And when you know that yes, now they won't be cheating. So ये 1000 बार खाना खाया, that was a wrong thing. Right? That was a wrong thing. Because what intention was, चलो यार इनके पास मुफ्त में खाना है, करो ऑर्डर, 1000 रुपए के पिज्जा ऑर्डर हो गए, and then I because I don't eat. So but we feel कि यार दोस्ती है ना, एंड वो मम्मी ने सिखाया था कभी किसी को खाना खिलाओ तो पुण्य मिलता है, वो पुण्य पुण्य में लग गई. महीने का 30-30 हजार का बिल आता था, बट आई आई यूज टू नेवर ऑब्जेक्ट ऑन दैट कि यार इसमें खाना खिलाने में क्या, कभी थोड़ा उसमें पैसे गिनते हैं. बट देन पीपल कैन बी दैट ब्रूटल. सो ये जो है दीज विल बी हाईली एसिडिक सेशंस, हाईली एसिडिक. मतलब सो मच सो, मैं अभी से बोल रहा हूँ, when we'll be discussing with males, तो yes at times not all females, कोई अपने पे मत लेना, right? But yes, it happens that some females they are with malicious intention, and same thing is true when we'll be discussing with the for the females. Then there are some males who are with wrong intention. बचना किन लोगों से है? With those people, बस. And for that, the way there are 5 red flags for female, similarly there are 9 red flags for male. जोक्स अपार्ट, मतलब जिंदगी में हाँ, मतलब कोई अच्छी लगती थी तो अरे वो बैठे रहते थे साइकिल पे, साइकिल थी तब, राइट? एंड शी यूज्ड टू ड्राइव दैट स्कूटर. हाँ, तो हंस क्यों रहे हो?
बड़े लोग सर, बड़े लोग.
हाँ तो यार वो अपनी एटलस साइकिल थी, तो ये क्या फास्ट चलाते थे. और वो क्या, दैट वाज लाइक अ जॉइंट क्रश. मतलब मेरे 3
Joint crush.
जॉइंट क्रश, इट इज कॉल्ड एज द जॉइंट क्रश. मतलब मी, my another friend who is surgeon, another friend who is ortho surgeon, अब साथ टेबल पे खाना भी खाते थे. मतलब हम लोग कैंटीन में मसाला डोसा तो रिकॉर्ड वाज 25 सेकेंड्स.
सर ये
मतलब वो
रिलेटेबल क्यों लग रहा है?
हाँ,
ये रिलेटेबल क्यों लग रहा है?
रिलेटेबल लग रहा है ना. हाँ मतलब सेम एज, मतलब वही है ऐसा. तो तीनों तीन फास्ट साइकिल चलाते थे. शी यूज्ड टू ड्राइव दैट स्कूटर, बहुत फास्ट चलाती थी. और हर बार क्या बोलते, ये रेड लाइट हो जाए, रेड लाइट हो जाए. So coming back to our topic, right? So this is what I was thinking about. All right. So that's how this is what is called as the cardiac cycle. From left atrium, things will go to left ventricle. Left ventricle say aorta, which is now having the oxygen and that is circulated into the entire body. And this thing is called as the cardiac cycle. Cardiac cycle. So blood keeps on moving on and on and on. हाँ, ये तो आप अच्छा बिहेव कर रहे हो तो others. When would these sessions start? वो will jointly अपने बात कर लेंगे कब करना है. श्रेया, ये रेड फ्लैग तो ये इट विल टेक 1 hour ठीक से समझाने में, राइट? तो विल डेफिनेटली, इसीलिए बोल रहा हूँ आई विल कीप दोस सेशंस. अच्छा, ओके. Now this would be our policy. Whenever we'll be discussing any of the blood circulation, we say we'll be moving from heart to heart. It means what? That is the heart, right? Blood goes out through which it will go out through aorta, but then from aorta through which arteries, branches, this, that, and then it will reach to the tissues, right? It will reach to the tissues. Oxygen, carbon dioxide exchange has occurred, right? And then it will return via veins, vena cava, and it will reach back to heart. So every time we'll be going for the complete circuit, right? This is circuit. We'll understand the whole circuit. This will give you the understanding that what would really happen when this circuit is disrupted, when it is broken, when it is damaged, maybe because of some trauma, maybe because of some pathology, maybe because of कि कहीं पे block आ गया, say for example myocardial infarction, right? So heart attack क्यों आया? Once you know this circuit, it will be much easier for you to diagnose any of the condition, right? So that's what is. हाँ, अभी रेड फ्लैग्स के बारे में अभी कुछ नहीं, बाद में बात करें. अदरवाइज दिस टॉपिक इज रियली इंटरेस्टिंग. सो अभी इस पे फोकस करते हैं. नाउ टू कंसेप्ट्स. वन इज थियरी, सेकंड इज एक्चुअली जानना कि इसको क्या है. व्हाट इज द बेस्ट टूल? द बेस्ट टूल, easiest tool is your stethoscope, right? Your stethoscope, by which you can really hear the things, right? ECG is surely good, but ECG के लिए you need to get that instrument. Even Apple Watch पे निकलता है, but that ECG is only one lead, right? It is just one lead ECG, one lead, which is practically of no use. It can detect something like atrial fibrillation, flutter when the heart rate increases. Tachycardia तक ठीक है, but actually if you really want to diagnose a myocardial infarction, तो नहीं कर सकते, or not possible. Right? So when we talk about ECG, we talk about ECG all 12 leads. Concept of sound, right? Stethoscope rakha and instantly you know that there is something gadbad. What's that? First, we need to talk about the heart sounds, right? What we say, lub dub, right? So we divide it into two parts. First heart sound and the second heart sound, right? Duck, 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 right? That's how it goes, right? But the sound type is lubbed up. It is lub, right? So that means lub. When you speak, there is vibration. Dup, right? It is dumped, dup, right? Lubbed up, right? So that's how it goes. All these sounds, they occur when there is closure of the valve, right? On valve closure. So this is what will happen, right? That the sound, when the valve opens, blood gaya, बंद हुआ. जब दरवाजा बंद होता है तब आवाज होती है. So this is the first thing. These heart sounds, they are the heart sounds. Heart sounds are normal. There can be third heart sound, fourth heart sound, that also will come, right? But अभी के लिए first and second heart sound. But when the water or the fluid passes the tube, passes the canal or the tube, there is no sound, right? पानी बिल्कुल सीधा जा रहा है. But when you pinch it, that kurr, right? That sound, what is called as the turbulence. When it occurs, whenever there is narrowing, right? So if there is any narrowing, it will lead to turbulence. Turbulence का मतलब when the fluid goes गोल घूमता है, and that is what we call as murmur. Murmur. Now, when the heart is contracting, so it is called as systole, right? So when the heart is contracting and we hear the murmur, heart is contracting, and we hear the murmur. So that is called a systolic murmur. When the heart is relaxing and we hear that sound, it is called as the diastolic murmur, right? Then there would be several things like pansystolic, holosystolic, right? All those things. Then ascendo, crescendo, all those. है बहुत simple. Ascending means right? That is ascending. So murmur aa rahi hai. If it is like gur, gur, so when you draw it, so it is of the same intensity, right? It is of the same intensity. Graphically, if you draw it, it is right? The same. When it is like this is ascending, descending, right? It is descending. So there'll be several type of murmurs. Now we feel कि हाँ ये तो एकदम easy है. ठीक है दोस्त. Heartbeat is normal heartbeat is 72 beats per minute. So एक बीट में कितनी देर लगी? Well, it is like 60 divided by 72, that comes to 0.8 seconds. 0.8 सेकंड में तो पूरा खेल खत्म. सिस्टली डायस्टली दोनों आ गए. And then you have to identify कि ये सिस्टली है, ये डायस्टली है, which is it is ascendo, it is crescendo. Yes, that is what requires practice, right? So इसके लिए there are some easy shortcuts to figure out that in which area it is. So on YouTube I gave one example that वो क्या था, मतलब there was some number. Say for example, if it is 10 plus there is some number and which is over here it is 25. So you can make out कि yes, this is 15, correct? Exactly the same way in our body, on our chest there'll be 4 areas. लिखा हुआ है, हाँ लिखा ही है, चलो, right? So I just say for auscultation. It is called as auscultation. Say doctor. This company's stethos is quite good, but otherwise अभी के लिए लेना हो तो you can buy the stethoscope. You love listening to your own heart, right? ऐसा लो कि which is less than about 1,000 rupees. अभी से straight away लिटमेंट में जाने की जरूरत नहीं है. They will cost you a bomb. और अभी क्या है कि इस पे अगर जो आपने नहीं सुना तो you won't be able to appreciate कि उसमें क्या मजा आता है, क्या चीजें ऐसी है जो सुनाई देती है जो इसमें नहीं सुनाई दे रही. ठीक है. सो अभी के लिए do buy one stethoscope and once you use it you can donate it to any of your junior. उनको दे दो, right? When you know that you are good in auscultation and then अब चाहिए कुछ बड़ा, so then you go for the good quality stethoscope because it will remain with you for whole of your life, right? So अभी के लिए, but yes, you do this practice. सबसे बढ़िया practice खुद पे करो, right? Listen to your own heart. So these are the 4 areas. 4 areas. Logic is very simple. The valve which is near, right? The valve which is near, and if you put your stethoscope exactly on that, तो वो जो valve बंद हो रहा है, अगर जो वहां पे एक turbulence है, तो that will be heard best. Bus. So that's the principle. So when we say we have got the mitral area, so that means on this area, mitral valve would be near. Tricuspid area, the tricuspid is near. Same way for aortic and pulmonary, right? So they will be near. So here it is the principle narrowing that leads to turbulence, and opening is always silent, right? Opening is always silent. Opening of valve, right? It is always silent. When it closes, then those flaps they takarate hain and then they make noise, right? So that is the clap.
Sir,
So
there isn't any damage due to the clap thing.
no, there is no damage. There is no damage because it is a very natural thing. These valves, they are so wonderfully, when we'll be watching those valves, we'll feel like कि ये इतने weak नहीं है. Valves, they are like connected with chorda tendini. Chorda tendini, they are so tough. मतलब बिल्कुल लिटरली जैसे वो अपने कैंपिंग में वो जो कैंप बनाते हैं और वो रोप्स बांध के रखते हैं.
Mhm.
When we were at Mansarovar, so we went to the Gauri Parvat. Right? RCSP is good, huh? अच्छा है, पायल अच्छा स्टेथोस्कोप है. So we went to that Gauri Parvat and रात को जो से तूफान आया था, but so those ropes, they are so tough, कुछ नहीं होता. Today's topic is Ruby. थोड़ा टाइम से आ जाओ, but the topic is vascular system. We are discussing vessels, blood vessels. Right? Right now we are at heart. So heart and blood vessel, that is our today's topic. So when the wall is narrowed, so we call it stenosis. And when the wall is not functioning, that means its function is unidirectional flow. It is when it is allowing even the reverse flow. So that is called as the regurgitation. I'll write it again. Right? I'll write it again. Don't worry.
The regurgitation is common in alimentary canal than blood vessels.
नहीं, regurgitation. Regurgitation तो दोस्त एक word है. Right? It is just one word. मतलब anything which goes back. But
Hmm.
yes, मतलब you are right कि regurgitation जो है digestion में हुए तब तक अच्छा
रिवर्स
है.
पेरिस्टाल्सिस।
तब तक अच्छा है, of course.
तब तक अच्छा है, नहीं तो वो तकलीफ कर दे. Right? So this is regurgitation.
Sir, it is a critical problem, right? In
This is a
blood
critical
vessels.
problem. Because see what happens is when things go, अरे ये again ये नाटक चालू हुआ. Zoom and zoom. हाँ. I mean, when the blood regurgitates, when the blood starts going back, that is an absolute confirmation that wall is damaged. Because under any circumstances, blood ulta to nahi jane dega. When blood goes reverse, this is the cusp. It is connected with cord-like structures. They are like
Chordae
they
tendon.
cannot contract, chorda tendini, and they are connected with the muscles. And these muscles are finely tuned by those SA node and AV node. They send the pulse, and then those muscles contract. Muscles ने वो cord खींची, तब वो cusp खुले, blood गया अंदर, and as soon as the second cycle starts, so these muscles they relax, the ठक से cord बंद, मतलब cord relaxed और वो wall बंद. When these cords they are not capable, when these cords rupture, तो wall बेचारा है वो cusp वैसे झूल रहा है, वहां से blood trickle हुआ, तो it is a serious problem. Right? So this is when the Doppler comes into picture. Doppler क्या था? When the blood comes, so it is red color. When it goes, it is blue color.
Blue.
Right? So the thing is, if you put the Doppler, your Doppler sensor over here, and during systole, you'll find the blood is going, but during diastole, blood it becomes red. तो ये कैसे आया? Right? Blood तो यहाँ नहीं आना चाहिए था ना. When the heart is relaxing, it is coming. That's the confirmation that yes, this wall is regurgitating. Then it is in which area, and then accordingly you take the call. Right? We'll learn all these things, but these are the basic principles. So let's start our journey with the left atrium. Left atrium, where oxygen has been given by the lungs, and now from left atrium it will go to left ventricle. Left ventricle is the strongest. It is toughest, right? So we'll change it to strongest. कैसे पता? अरे जब देखेंगे तो the walls, right, in dissection,
Yeah, thicker.
yes, they are the thicker, must एकदम thick walls, because it has to squeeze the blood and throw it to the entire circuit. Brain तक भी जाना चाहिए and all the way up to the toes भी जाना चाहिए. Toes में तो ठीक है, gravity is helping. Brain is something which is 2% of the weight, but it is consuming 30% of the entire oxygen.
Also, it is very selfish.
It is selfish and होना ही पड़े because it is the command center, right? And दूसरी खासियत कि heart and lung, no, not lungs, heart and brain, these are the two organs which never regenerates. अगर जो कुछ damage हो गया, तो that damage is forever. Gone is gone. Khatam. Right? So that's why they do have there is a certain window. Say, बहुत पहले मैंने ये शायद बात की थी, but you should keep this tablet at your place. Tablet, sorbitrate. Everyone should be keeping it. 10 tablet 7 रुपए की आती है, 7 से 10 रुपए की, right? This tablet, एक 10 tablet लेके घर पे रख देना. You never know. आपकी जेब में भी होनी चाहिए. If you are going to gym, तो आपकी जेब में at least 2 tablet रखो आपकी gym bag में. This thing will be life saver. Because tablet sorbitrate, it is like a cardiac tonic. It gives you that window कि अभी आपके पास 45, जो मतलब किसी को heart attack आया. You just push this tablet into his mouth and tell him or her कि चबा जाओ. The moment they chew it, it goes into the circulation, it bypasses the liver. So straight away it will come into the circulation, sublingual, jeep ke niche, right? And chew it so that that powder gets absorbed from there. This will give you the window of more than half an hour. Person might think, हाँ पेन चला गया, नहीं पेन आया, and there is no side effect, कुछ नहीं होगा, मतलब there is nothing can go wrong, right? But it will save the life. So this is, and it is so cheap. मतलब इवन कोई कहे कि भाई एक्सपायरी निकल गई तो यार निकल गई, फेंक दो, go for the new pack, right? It's a matter of 7-10 rupees.
So
Okay.
it's a steroid, right?
No, it's not a steroid. It is the cardiogenic. It supports the cardiac activity.
Okay,
So the valve is wider in regurgitation. नहीं दोस्त, valve wide नहीं होता, but that leaflet, right, which was tight, it becomes loose. So the cusps, they are like this, right? Previously the cusp, they were holding it like this. They were tough.
they
But
become
now they
flaccid,
are
right?
hanging, right? They are hanging. So even if the blood is trickling, तो this valve is not able to prevent. पहले क्यों नहीं वो वापस जा रहा था? Cord ने यहाँ से पकड़ के रखा था. The valve was not allowed to go up. Now this cord is broken. Cord tendon is broken. So this valve, it becomes like a loose tissue. So even if the blood is trickling, it is just going like this. So this is what is called as a regurgitation. Valve size, उसकी ring होती है. That ring remains the same. Ring में कुछ नहीं होता, because if the ring ruptures, so then it is the person won't survive, because then it will lead to rupture of the entire heart, especially when what really happens in case of aneurysms, right? When the wall becomes thin, so if there is any break, तो वो heart मतलब it फट जाता है, मतलब there is nothing can, no one can do anything, even operation, मतलब hospital में तो भी कुछ नहीं कर सकता.
It is said to be natural death, no? Aneurysm.
हाँ, मतलब people are having known cases of aneurysm, but they are like time bomb, चलते फिरते time bomb है. So you will give all sorts of medicine to them, but if the day it ruptures, nothing can be done, nothing. Saggy valve. Good word, right? So regurgitation is like saggy valve. Okay, so that's now, so we are into thorax, right? Chest. This is the left ventricle. Now, you remember we talked about this. This is right atrium, right ventricle, left atrium, left ventricle. Like this, the position of the heart, tilt and rotate, tilt and rotate. So now if we watch it from the top, so from the bird's eye view, the situation would be something like that. If this is the front, so we are facing right ventricle straight, left ventricle, this is on the left side, this is the right side. So this is right atrium, and over here, this is the left atrium, which is posteriorly situated. Posteriorly situated over here, nearest structure is, which structure is this? This is esophagus, right? Esophagus. Give me a second, someone has come. I'll be back. So this is esophagus, right? Which is just behind. So when the esophagus is over here, right? Now you'll be able to understand, say this, watch this. So let's try it new. Here is the heart. This is mitral valve, correct? This is mitral valve.
Yes.
When this is the left atrium, when left atrium has to work so much to push the blood into the left ventricle, right? So then left atrium would be enlarged. So in which case left atrium has to work more? Mitral stenosis or regurgitation?
Stenosis.
Stenosis, right? When it is narrowed. So when there is stenosis, when the valve is narrowed, left atrium has to work extra hard when anyone is working extra hard. So ये तो left atrium is in gym, right? So it will expand, it will hypertrophy, right? It will become bigger. It will become bigger. So mitral stenosis. So this left atrium is enlarged. If left atrium is enlarged, so it will lead to what? It will push the esophagus. Now esophagus तो बेचारा ऐसे ही गरीब है. Very delicate collapsible tube. तो क्या किया? Push कर दिया इसको. Esophagus is now pushed. There is not much space over here, right? Left atrium is pushing. So it leads to compression effect. Compression means what? Person would find it difficult to swallow. Right? Person would find it difficult to swallow. This is what really happens. Right? So difficulty in swallowing is called as the dysphagia. Dysphagia. Right? Difficulty in swallowing. So over here, laterally, when you take the barium swallow, right? You put the barium, ऐसे बेचारा swallow नहीं कर सकता. We become still कि चल ले पी, white color का barium, right? And when he swallows, so we'll find, yeah, instead of straight barium, right? It is giving a curve because the left atrium has enlarged. So it has pushed the esophagus and we see this compression effect, right? So this is one of the things. Then on X-ray chest, जो अपना this graceful curve था, right? Which was left atrium was over
It
here.
becomes straight.
Correct. Very right. That becomes straight because left atrium has enlarged. So it has filled up this space. So now this is what is called as the straightening of the left heart border, right? I'll show you several X-rays of all these things, but this is just for you to understand the concept, right? Straightening of left heart border. Commonest cause. Now, there can be another causes also, right? There might be some lymph node, there might be some myxoma, right? All those conditions, they can occur. But how to, if you know one condition, so that condition will come up into picture. When we'll be learning about the lymph nodes, so then you'll find the structure of the lymph node, normally they are not seen, but when they are enlarged, they become big, their density increases. X-ray is nothing but the game of density. So now those lymph nodes, they have become bigger. So they can also impart that shadow. But lymph nodes, they are not like army soldiers in discipline. Everyone is enlarging in different way, right? So there would be straightening, but the straightening would be like this. एक straightening ये है, and दूसरी straightening would be like this. Right? So you get the idea that this border, this edge, it is wriggled edge. Yes. So it is not the left atrium. Left atrium to smooth wall and large ekdam straight. Right? So that's how we'll be going for the differential diagnosis. Abhi ke liye, not to worry for this. Right? I'll show you the X-rays. I'll show you the even CT scans. Right? In CT scan, we'll see this thing. So coming back to our left atrium. From left atrium, it goes to left ventricle. From left ventricle, there goes the arch of aorta, right? Now this aorta, up tak jo we were drawing like this is the real structure. This is how it looks. It goes. From left ventricle, what it goes up, it is called as the ascending aorta. Then this ascending aorta takes turn. So this ascending aorta is situated anteriorly, and descending aorta, it is situated posteriorly, right? Anterior and posterior. What word? Starting from M. What was the word?
So can you repeat the question?
Question is, anterior ascending aorta is in anterior what? This fill up the blank. The
Medial.
word
Major.
mediastinum. याद है?
Yes, sir.
Mediastinum. So there is anterior mediastinum, posterior mediastinum. There is right, left, middle, right? So that is where the lungs. See those. This was the chest. These are the lungs. So we say this is the lung. This is the lung.
Yes, mediastinum.
Yes,
Yeah.
sir.
Similarly, side से देखो तो anterior and posterior में divide किया हुआ है. हाँ, you wrote it in message, right? Good. right? So this is anterior mediastinum and this is posterior mediastinum. So this gives us a clear understanding that anteriorly the ascending aorta starts, but then it goes back. So this area is near the spine. So here there would be spine, right? Now, when we'll be discussing CT scan and when you'll see it in right, there would be multiple aha factor. Yaar, maja aa gaya, right? Why? Say for example, this is cutting the X-rays, right? They will slice. CT scan is like a sliced radiology. So as if you're taking a slice. So you took a slice at this level, right, which is just below the angle of Louis. Right? So over here, how does on CT scan things would look like? If this is the spine, this is the spine. So you will watch one beautiful tube like this, another beautiful tube like this, and we say that both of them they are aorta. दो कैसे aorta? Aorta तो एक होती है, हाँ, but because it is taking the turn, right? So this tube was sliced here, and this tube was sliced here. So that's why वो दो दिखे. As we go down, ये धीरे धीरे दिखनी बंद हो जाएगी, right? And then they will be watching only this aorta, which is called as the descending aorta. It is going down, correct? Right? And as we go up, तो एक level पे यहाँ पे जो cut मारा, तो will watch an oblong tube. It will not be round. Aorta is perfectly round, एकदम मस्त round tube. But at this level, it would be oblong. क्यों oblong? Because we are cutting the tube at that level, कि जहाँ से वो उसके curve पे, from where it was at the curve. So that's why we watch both the things, right? So that's why this would look like an oval. Right? Are you with me? Understanding it
Yes,
properly? You can? Shabash.
Yes, sir.
So in CT scan, this would be our base. This would be our base. This is the habit which you have to cultivate, that whenever any of the image, radiological image comes, first figure out क्या आता है, क्या पता है, beyond doubt क्या चीज पता है. तो you will say कि spine में मैं कभी गलती नहीं कर सकता है, कर सकती, right? Aorta तो बिल्कुल पक्का concept एकदम clear, ठीक है. Now take that thing and then we go for next journey. That is के pulmonary trunk कहाँ पे है. So for that we need to understand कि pulmonary trunk का क्या association है arch of aorta से. So because it will be there in between, right? So when we see that, then we'll see, say for example, what about the kidneys? What about the liver? So that way, how CT scan I'll show you is, I'll start at one level and then we'll keep on dissecting. We'll keep on taking the slice. So I'll be showing you one patient CT scan, all the images from top to bottom. The idea would be to identify the structures. So, and then I'll insist कि उसके अंदर last image होगी. That image would be a random image. Random image means I won't tell you कि वो किस level पे ली है. You have to identify from which level it was taken, and then you have to identify all the structures. That would be like your practice. Once you start doing it ना, एक बार वो पता चल गया, you will find that CT thorax, CT abdomen is bit tricky. मतलब I won't say it is very easy, but CT thorax में तो आप कभी गलती नहीं करेंगे, कभी गलती नहीं करेंगे, because there will be so many landmarks, right? Okay. So this is left ventricle to ascending aorta, arch of aorta, and the descending aorta, and that's how it continues, right? So we
So
say that
would you please repeat? My network was out of.
what Hamza? What do you want to get repeated?
Would you please repeat? I didn't understand that. My network was not proper.
This we talked about the ascending aorta, arch of aorta, and the descending aorta. Descending aorta is into the posterior mediastinum, so it is near to the spine. Right? It is near to the spine. So visually, all you need to remember is anterior shuru hua, arch is going posteriorly, and then the aorta is going down. Right? So this we are drawing in 2D, but you have to understand it in 3D, starting from anterior and then going to the posterior. Right? This concept is clear to you?
Yes, sir.
All right. Sure. So now heart is like a bank cashier. Bank cashier has to survive in his salary, though lakhs and crores of rupees are passing through his hand. No, it is not his money, right? That is something which is similar to what's called as the coronary circulation. So in coronary circulation, we say that there is right coronary artery, there is left coronary artery or left main artery, and then there is left circumflex artery. So these arteries, then there are septal arteries which will be supplying to this atrioventricular septa, etc. That's a different thing, but these are the three main arteries. Arteries, they are not seen, right? Today I'll show you that arteries, when you take a normal X-ray, they are not seen because structure of the arteries as such very delicate, soft tissue. The X-rays will be passing through and through it, so it won't be imposing any shadow. But when we inject the dye, now these dyes, they are called as the radio opaque. Radio opaque. Radio opaque means radiations cannot pass through it. If radiation cannot pass through it, so that means those X-rays, they will be stopped at point. So wherever the artery is, it will look white or black. Artery will look white or black. When X-rays,
White,
right?
white
Because
fluid.
X-rays never reach to the plate to turn it black, right?
Yes.
That's why they are called as a radio opaque. So that is what is called as the dye. Okay. So myocardial, myo means muscle, cardial means heart. Infarction, that is infarction, INFARCTION, infarction means it is not getting blood. In other words, that is the medical name of heart attack. Right? When it occurs in heart, it is called as heart attack. When it occurs in brain, we call it stroke, right? But in both the cases, if the blood is not reaching, then the damage is permanent. Right? There is a small window for which they can survive. Muscles, they can survive without blood for a very long duration. Liver can survive, lungs can survive. Heart and brain, it's a matter of minutes. And once they die, they cannot regenerate. Right? While others, they can regenerate. Can I take this call? Because this is from Amazon. I think they have solved the problem. Let me check. Sorry. Hello. Yes. Yes, Rushi, tell me. Yes, we talked before a few days. Yes, correct. Great, great. Urvashi, I checked today morning. It was not resolved, but now if it is resolved, so can you give me just half an hour, about say 45 minutes, within 45 minutes? Tell me. See, if they are telling day before yesterday, so then that is not possible because yesterday I talked to Durga and she said that we are trying our best to resolve it. And so till late evening, nothing was there. There is no email also. I understand. Hmm. Correct, correct. They can resend it, no problems. Huh, huh. But Usha, there is no resend option. There is no resend option there. I just can't see any resend. No, it is not there. Even Durga also asked me. Huh. Okay, can we? Is it okay if just give me 45 minutes? I'm in the middle of a lecture. Just give me 45 minutes. Can I call you back on this number or you'll be calling me back? All right. All right. Exactly right now it is 11:05, right? We talk at 11:45. Is it fine? Okay. Okay. Sure. Thanks, Urush. Thanks. Bye-bye. Thank you. Same to you. Thank you. Bye-bye. चलो अच्छा नॉर्मली आई डोंट डू दिस बट ये तो मतलब नाउ यू आर लाइक कि चलो घर के हैं चालू लेक्चर में भी फोन ले सकते हैं अदरवाइज आई डोंट टेक इट
Now we are also excited to
हाँ यार
listen that problem is resolved or not.
resolve सही बात है नहीं हुआ नो दे आर नॉट डन इट इट इज स्टिल देयर so coming to this bank cashier, right? That's a salary. This is a coronary circulation. This coronary circulation, right, which is comprising of this right coronary artery, left circumflex. This improves with exercise. So once it improves, so definitely it will be like a, Ashika, your mic is on. So this is what is called as the hypoxia. When the blood is not reaching, it is called as hypoxia, right? The most sensitive area into the entire body is medulla oblongata. Medulla oblongata, where there is a respiratory center, right? Because it is an automatic process. So this respiratory center is the most sensitive to hypoxia. So if the blood is not reaching, this is the center which gets damaged. The important 5-minute window is for this purpose only. That 5-minute window is crucial for this purpose because within this 5 minutes, if this medulla oblongata is damaged, so then you put the patient on ventilator. As far as ventilator is working, right, chest is moving up and down, and they say, okay, yes, patient is fine, but no, patient is not fine. Patient is, because without ventilator, he or she won't be able to survive, and there is no logic. So it is like with heavy heart, at times you have to really stop the ventilator. So that's what really happens. अरे यार क्या हो
Sir, is it a case of brain dead?
Is it a pray for? हाँ क्या? What's your question?
Is it a case of brain dead?
Yes, it's a case of brain dead. But in India, it is like person is declared dead when the heart stops. In USA, person is declared dead when the brain stops. So in US, so they don't keep it on ventilator even for a minute. The moment on MRI it is seen, those dark patches, it is known that centers are damaged. No way they can recover back. And patient is declared dead. Even if the heart is working, everything is fine, but no, because he or she won't be able to survive by himself or herself.
Okay.
For aerobic and anaerobic, right? For aerobic and anaerobic, these are the exercises when aerobic is that is in presence of oxygen, but when HIIT, high intensity interval training, for there would be some stage when there will be less of the oxygen. So that is when you are conditioning your heart for functioning with less oxygen. Right?
Lactic acid accumulation.
Yes, lactic acid accumulates. Now here are the branches. And we on CT scan will be able to see all these branches. But remember now so many tubes, when they'll be cut, they'll be looking like small round circles. But every circle is some artery, right? So here it is. This is from left ventricle. This is the anterior side. That's the arch, and this is posterior. From the anterior side, there goes, this is the right side. There goes first one, which is called as the brachiocephalic trunk. Trunk means that means it is a big tube. So three tubes. So that is brachiocephalic trunk. So this brachiocephalic trunk, when it goes out, right, this is only on the right side. On left side, there is no brachiocephalic trunk. So it goes out, and over here, This is the right common carotid artery. One artery which goes up. This is a big artery. It goes up. It is right common carotid artery. Right? Then this continues as subclavian artery. So there is right common carotid artery goes up, and this is right subclavian, it continues. But that's the difference. So if you remove this brachiocephalic trunk, so on left side, this is the left common carotid which goes up, and left subclavian, it goes directly. Bus. So now on both the sides, we have common carotid artery, we write it lovingly as CCA, right and left. That's the artery. When you touch over here and you feel those throbbing pulse, big pulse, right? That is the common carotid artery. Right? In movies, when they say कि वो blade से काटा और खून उड़ा, yes, that is the common carotid artery, because the blood pressure in this is mean. Even the normal blood pressure is 120 over 80 millimeter of mercury. Mercury is 13.6 times heavier than water, right? This is 120 millimeter. That comes to 12 centimeter. 12 centimeter. Multiply it by 13.6, right? Because it is the mercury. It can raise the mercury level to that much. That's why in our those sphygmomanometer, right? वो शू करके हवा भरते हैं, that blood pressure instrument. It is mercury, right? अगर जो पानी हो तो 6 फुट का लेके निकलना पड़े, right? It would be because it will be able to raise that much. Now this is centimeter, 12 centimeters. When you multiply it to 13, right? So this comes to what? It will be
169 approx.
Right? And if it is roughly 260 भी गिन के चलो, 1 meter is how much? 1 meter. 100 centimeters?
100 centimeter.
100.
This is 2.6 meter. 2.6 meter. That much big, that would be the column. That much is the pressure. So when this is cut, तो then they दिखा दे ऐसे खून उड़ेगा, right? It will be it's real because the blood is coming from, and blood is getting pumped at the rate of 5.5 liters per minute. That's the speed at which the blood is going. So if there is any break, person dies on the spot. सबसे dangerous चीज जो पतंग उड़ाते हैं, right? And that Chinese dory,
Yes, sir.
yes, patang mein, it acts like a knife, right? My father got injured for that. It was so crucial. Matlab, I was there. Literally, it was pushed. You have to push it with the thumb, and then you have to carry him so that no bleeding continues. It was a very major thing. He survived. But
So
injury,
both side of head there is artery.
yes, on both the sides, because left common carotid and right common carotid. So when you take the pulse, whenever you do exercise, you take the pulse with 2 fingers, right? So that throbbing, what you are learning, what you are experiencing is that.
That's why it is recommended to not take pulse from both side at a time, right?
Not take.
Pulse from the both side at a time.
You can take because it is the arch of aorta, right? Blood is getting pushed from both the sides. So you can take.
If we take from the both side at the same time, it is said not to be done, right? Because the blood gets.
हाँ, कुछ इतना फर्क नहीं पड़ता. We can't compress that carotid artery because when you see, look at the carotid artery, it is so stout, so powerful. We cannot compress it, right? Even किसी ने से दबा भी दिया तो कुछ नहीं होता. It is very powerful. The arteries which can be compressed only, they can be compressed only if there is a strong base underneath it. पत्थर के नीचे you put the नारियल and then you break it, वो नारियल टूट जाएगा. रेत में दबा के, रेत है, right? Sand, put the नारियल, उसके ऊपर हथौड़ा मारो तो भी नहीं टूटेगा because it will just sink. So over here it is all soft tissue. So even if you press, it will respectfully go inside. That's not the case when you are taking the pulse over here because there is a radial bone, that flat bone, right? That flat bone. And uske upar se radial artery ja rahi hai. So that's why you can feel the pulse very nice. But when you press it, then it will be pressed against the bone. Right? So that's a different story. But over here, it is not easy. Unless someone is strangulating, then that person will die not because of the lack of blood, but because of the trachea. Right? He or she is not getting the air. So it's suffocation. Yeah. जब फांसी चढ़ाते हैं, right? तो then जो यहाँ से डाला, and then पीछे there is a knot, so that dents breaks, right? So this is
Okay.
atlas, this is axis, so it is this dents. So in fasci, this dents breaks. When dents breaks, so यहाँ पे तो there is medulla oblongata. So that medulla oblongata is damaged. When medulla oblongata is damaged, so you know the game is over. Right? So that is what really, we'll see that thing in forensics. So this brachiocephalic trunk, and then there is subclavian, subclavian to axillary, axillary to brachial, brachial divides into radial ulna, and it supplies the all the way to the upper limb. Right? Same way over here, it is the subclavian artery to axillary artery to brachial artery goes down, radius ulna, and then it supplies the upper limb. Right? That's how things they really go. Now we talk about the common carotid artery. This common carotid artery on both the sides, it goes up. And as it goes up, it divides into external carotid artery and internal carotid artery. So external and internal divides into, right, these two arteries. This is on right side. Same way, on left side, left internal carotid artery and left external carotid artery. So this external carotid artery would supply the face, and this internal carotid artery, they go all the way into the skull to supply the brain, right? So that's how they go to the brain. Now there is another artery which is called as the vertebral artery, a very smart artery. This is the artery which is coming from here, from subclavian, and here also it will be coming from here, and that is the vertebral artery. So these vertebral artery, what they do is, vertebral artery, so here is the vertebral artery, vertebral artery. These vertebral artery, vertebral, right? Name itself is telling that this is from vertebra. So it goes back, piche. Piche jaake, they both join together to form what is called as the basilar artery. Basilar artery, right? And then these internal carotid, that internal carotid, it goes inside through the internal carotid foramen, right? Through carotid tunnel, it goes inside, and then it divides. So then all the names, anterior cerebral artery, middle cerebral artery, posterior cerebral artery, these are the names, right? So from all the sides, these arteries, they come and they form a complete circle. This circle is the joint effort of all cerebral arteries, basilar artery, and this is collectively called as the circle of Willis. Circle of Willis, right? Then we'll be talking about brain. So this is what we'll understand along with the angiographies, that how this circle of Willis formed. But in nutshell, it is the contributors are vertebral artery and the internal carotid artery. That's how, or both the sides, right? That's how they make the blood supply. Now we focus on this subclavian artery, right? We are right now dealing with the right subclavian artery. This right subclavian artery, there are three parts of it, right? Same way for the left also, but we are right now focusing on right. There is a muscle which is called as pectoralis minor. Yes, we know that this was a small muscle, right? So this artery goes underneath this pectoralis minor, underneath. So obviously we can divide it like this. The part of the artery which is before pectoralis minor, the part of the artery which is underneath or behind or below pectoralis minor, and then third part which is beyond. So this is called as the first part, this is the second part, and this one is the third part. First part has got one branch, second part has got two branches, and third part has got three branches. A very favorite question of Viva, right? Very easy to remember, right? The way to remember this branch of axillary artery, right? That is, she tastes like sweet apple pie, right? These anatomists must be very romantic. Now, यहाँ पे भी she try to catch her. Seriously, so many memories are like that. पर वो याद रह जाते हैं.
Sims.
Ah. So this is the first part, right? This is the first part. This is S, superior thoracic artery. सही बात ना, superior thoracic artery, because even if you look at it, this is pectoralis minor, this is thorax, and यहाँ से अगर जो if there is one artery coming out, so this is way high. So it is very much justified to name it as superior thoracic artery. Correct? Only one branch. Now, two branches, they are emerging from the second part. Now, these two branches, T. T is thoracic acromial, that acromion process, right? So it goes over there, thoracoacromial process. And L is lateral thoracic, as it goes laterally, right? So these are the two. In dissection, we'll see all these branches, all these. And the third part, this is the third part, right? So in third part, there are three branches. So one is subscapular. Can you imagine? कहाँ जाती होगी? This is the back. This is the back. उसके
Yeah.
पीछे लगा है scapula. Back और scapula के बीच में. That is what is called as subscapularis. Subscapularis means underneath the scapula. So got the idea? There is a muscle called subscapularis. So subscapularis कहाँ पर? ये आपकी back. ये side में से देख रहा है. That's the scapula. This is the scapula. Anything which is over here, it is called as the subscapularis. Sub. So subscapular artery, subscapular muscle, subscapular nerve, they all will be here underneath the scapula. So easy. Right? Then comes the A. Anterior and posterior. As we have come
Sir.
down. हाँ बोलो.
Sir, can we say that second part of the artery, the main artery which is branching into this part, is subpectoral?
हाँ बट कैसे बनाओगे नई टर्मिनोलॉजी बनाओगे इट इज सब
नहीं
पेक्टोरल
मतलब
माइनरिस तब तक तो भाग जाएगा कोई
नहीं मतलब
हाँ हाँ
is it correct
हाँ
by
हाँ करेक्ट
sense?
नेक्स्ट एनाटॉमी नोमेनक्लेचर में आई पुट करेक्ट
Okay.
हाँ कर सकते हैं इट इज सब
No, sir, I was just clearing the concept
अरे
like
बिल्कुल
of the
बिल्कुल
sub.
अरे नो प्रॉब्लम बिल्कुल हाँ सो राइट so here it is the third one is subscapular and this we are talking about यहाँ पे अब तो ह्यूमरस आ गया right because that artery is going down. So humerus, the upper part of the humerus has come. This is the neck of the humerus. So then two arteries, they will wind around. One, two, right? They will wind around. एक anterior से posterior, दूसरी posterior से anterior. They will wind around. That's why they are called as the circumflex. Circumflex, humerus पे है, so humeral artery. So one is the anterior circumflex and second is the posterior circumflex and they both meet. So many messages. What? Underscapular, that's right. That's right. Samsung X216B, those must. I would say this thing to everyone. You are 110% right. This is the carotid artery, common carotid artery. This is the reason for all the neck surgeries, the incision is always vertical. It is never as a transverse. It is always vertical. So in this case, and it is very light, you cut the fascia and then you keep on opening it. So there is always a vertical incision. Vertical incision. Fantastic. What's your name? You are there or not? Don't know. Okay. So this axillary artery, as it will go down, it will come across this teres major. Then at the joint, it will be called as the brachial artery in the cubital fossa, right? The way that elbow fossa. So it is called as the cubital fossa. It goes down and it divides into radial and ulnar artery and it supplies the upper limb. Next is, this is thorax and abdomen, right? So this is the diaphragm. So above is thorax, below is abdomen. So whatever the things which we eat, drink, finally, it will be going to the liver. Abdominal aorta, right? It will take the blood to abdomen and pelvis and the lower limb. And there would be some collateral circulation. That means formation of plexuses, right? Collateral circulation. That means some bypass also. Anastomosis will be there. There would be one artery which will be giving blood to will be giving oxygen to the liver. Now see, For liver, this portal triad, hepatic artery, portal vein, bile duct, how is it all happening? This is how it is happening. Abdominal aorta, right? This is called as the abdominal aorta because now it is into the abdomen. It has crossed the diaphragm. Up till now, this was called as the thoracic aorta. Right? It is just the change of the name as it passes the region. It is divided into one, celiac trunk, second, superior mesenteric artery, third, inferior mesenteric artery. As said, there are several other arteries also. But these three arteries, they are the main arteries: celiac trunk, superior mesenteric, and the inferior mesenteric. It has got direct correlation with the embryology. Right now, we'll not make it complicated, but it is with a major association is with embryology. This is our digestive system. In digestive system, it starts with stomach, right? That's the stomach. Here it is the stomach, then stomach, then this curved part, this is called as the duodenum. Duodenum has got 4 parts, right? This is the first part, that's the second part in which ampulla of Vater, that is from where the bile comes, and the pancreatic duct, it opens. This is the third part, and this fourth part, which goes into the posterior mediastinum. So it goes, takes turn. So these are the 4 parts, then the jejunum, ileum, and duodenum, jejunum, ileum. Duodenum, jejunum, ileum, collectively they are called as the small intestine. Then there is appendix. Then this is what is called as the cecum. From cecum, this is called as ascending colon, which goes up. Then there is transverse colon, and then there is a descending colon. Big tubes, they are called as the large intestine. Then to sigmoid colon, rectum, and the anal canal. So that's how the entire digestive system is formed. The most beautiful thing is that from esophagus to duodenum, up to the third part, duodenum 3, that is by celiac trunk. From fourth part of duodenum to splenic flexure of transverse colon. So here it is the transverse colon, right? This one is the transverse colon. So when we say this is like a transverse colon, on one side there is liver, on the other side there is spleen. So this area is called as the splenic flexure of the transverse colon. Flexure means from where it is taking the turn. So from here it will take the turn, it will go down. So this curve is called as splenic flexure because spleen is present over there, right? All right, so your name was Soumya. Good, Soumya. That carotid part. So this is cecum, appendix. So watch it like this. The distribution is up to splenic flexure of transverse colon, and then inferior mesenteric is supplying from splenic flexure to the end till the anal canal. So thus the entire digestive system is divided into 3 parts: celiac, superior mesenteric, inferior mesenteric. You have learned the blood supply of the entire digestive system. Then rest is what? Rest is the names of these major arteries. If it is going to duodenum, right? Or if it is going to jejunum, so it is called as jejunal artery. Is going to ileum, the ileal artery is going to appendix, the appendicular artery is going to celiac, the celiac artery, right? Cecum, the cecal artery. So that's how it is laid. And when
Sir,
it is going to, bolo?
sir, just after this completion, can you just one more time revise the abdominal circulation?
See, we'll do it right now. This is what you're talking about, right? This part.
Yes, after this. Okay, yeah,
After this
yeah,
one,
this
or
one.
this one, this is main.
The D1, D2, D3, you explained that thing, and the
See, easy. This is the stomach, right? This is the stomach. So then after stomach, this is C loop of duodenum. So this is called as duodenum 1, this is duodenum 2, this is duodenum 3, and the duodenum 4, this posterior portion.
okay,
So from here, things start, right? So up to this level, it is the celiac trunk, which is giving the blood supply. And then splenic flexure, so you have understood, right? So that is duodenum 4 to splenic flexure, which is a superior mesenteric artery. And then below, inferior mesenteric.
okay,
This aorta, when it continues down, it is divided into common iliac artery. left common, right common, and then it once again divides into iliac, external iliac and internal iliac. It divides, and then this internal iliac, it supplies the pelvis, pelvic organ, and this external iliac, it goes down, and now we'll be calling it as femoral artery. Femoral because it has reached the thigh. So now we'll call it femoral artery. Otherwise, it is just the continuation. But then there is one artery which will be going back. This artery is called as see how enthusiastic this artery is. It is called as the profunda femoris. It got zoomed by itself. So this is called as the profunda femoris. Profunda means big, khub sara blood, right? So it takes large amount of blood, and that these two joint effort, femoral artery and the profunda femoris, they supply the entire lower limb. When it comes to veins, things are as such same with minor change. All the blood should reach back to right atrium. So from lower limbs, it comes via IVC, inferior vena cava, and from head and neck, face, it is via superior vena cava, right? Because it will be carrying carbon dioxide. So let's see how this vena cavas, they are formed. First, we talk about superior vena cava. From upper limb, now the blood is returning, right? It has gone into the form of arterioles to capillaries. It has given the blood, then carbon dioxide is taken by the blood, and then those arterioles divided into capillaries. Capillaries unite to tributaries, to bigger veins. So now this is our axillary vein.
Sir,
So
we
that
have to
axillary vein.
study even those small capillaries.
No. Small capillaries we don't have to study, but we
Okay.
should know.
Okay.
Otherwise, so artery, once the artery reaches, main artery reaches, so then all those divisions, so they are at a cellular level, at a microscopic level. So here it is axillary vein, subclavian vein, right? And then it will be meeting over here, external jugular vein, internal jugular vein, and this is now brachiocephalic vein, also called as the innominate vein. Innominate means जिसका कोई नाम ही ना हो, मतलब पहले पता ही नहीं चलता था कि क्या नाम देते, बेनाम, right? उसका नाम दे दिया बेनाम, innominate vein. Same thing happens even on the opposite side. So here also they meet internal jugular vein, external jugular vein, and innominate vein, which is also called as the brachiocephalic vein, and both of them they unite to form what is called as superior vena cava, and it continues into the right atrium, right? So that's how it goes. From below, the circuit is easy. The way there was femoral artery, similarly there is femoral vein. They both run parallelly, and it is exactly the same. So this is the femoral vein. It continues as external iliac vein. From the pelvis comes internal iliac vein, right? Internal iliac vein. Both of them, they unite to form common iliac vein, right? So it is happening on both the sides. It is called as the common iliac vein. Both these common iliac veins join to form inferior vena cava. Renal veins, they are like tributaries. They also join, and finally this entire, and then hepatic veins, they will also give the blood, and this unit now will be called as the inferior vena cava, and it will be landing this big tube into the right atrium. So thus right atrium has got like this type of structure. So superior vena cava comes, inferior vena cava comes, right? And they both go into the right atrium, right? So this collected blood, and then it moves further to right ventricle. The last topic. This topic is, it is for that concept so that you never ever confuse between what is called as the portal circulation. Number of diseases they are associated with it, but if you remember just this one figure, it will be answering multiple things, right? So let's start. This is liver. This is liver. At any point, if you find nahi pata chala, say immediately. This is liver. Liver is on right side and spleen is on the left side. Spleen kahan pe? Just on, put your hand like this on the left side. You are actually putting your hand on the spleen. And liver is entire on the right side, right? So here it is. Those veins, right? The way there were arteries, celiac artery, supramesenteric, inframesenteric, the same way there are veins. But see, these veins, they are not forming sida, they join the inferior vena cava. Nahin. Supramesenteric vein, which is draining the blood from D4 to transverse colon splenic flexure. Correct? Supramesenteric. Inframesenteric transverse colon splenic fracture to anal canal. They move up and they join the splenic vein. So here is, that's the splenic vein. That's the splenic vein. And over here, inferior mesenteric vein and the superior mesenteric vein, they all join. And when they join, this unit is now called as the portal vein. So this is a big portal vein. So what portal vein will be doing? It will be taking the work for liver. It will say, okay, whatever the things which person has consumed, whether it is alcohol or it is anything else, sab liver mein jata hai. Right? Liver has to take that insult. So it goes to liver, it is processing. Liver will process it. Meantime, liver will be requiring some salary. So that salary will come from hepatic artery. So what that salary would be having? It will be having oxygen and the nutrition. So that oxygen or nutrition that would be given by given to the liver by aorta via hepatic artery, and portal vein that is carrying the food stuff, right, which is to be metabolized into the liver, which has been absorbed into from the digestive system. So liver would start processing it. Liver would process, and finally the output is given to hepatic vein. Right? And it is said that, okay, now this is the nutrition distribute across the whole body. Meantime, liver has got one more function, and that is production of bile. Bile, right? Production of bile. Function of bile is to break the fat soluble substances. That's the function of bile. So bile gets collected into the gallbladder. And that gallbladder will be coming out via a duct, right? That is called as the cystic duct. Cyst matlab bag. So here it is. This is the liver. Now in liver, we have got one hepatic artery. Hepatic artery is like celery. Right? It is like celery. Fine. Portal vein, which was formed by that splenic and supramesenteric, inframesenteric. So portal vein is giving the work. And then there is one more, which is called as bile duct. Bile duct. So this bile duct is making the bile, and this is storing it into the gallbladder, right? Gallbladder. So that is called as the portal triad. Hepatic artery, portal vein, bile duct. Bile duct also called as the cystic duct, right? So these three, they enter the liver, and then what is coming out? Only the nutritional part, which is injected into the hepatic vein, and that is taken all the way to the inferior vena cava. From inferior vena cava, it goes to right atrium, to right ventricle, and then circulated into the body. Now, this is one example of DSA, digital subtraction angiography. So what really happens is, first you take the normal X-ray, right? This is a normal X-ray. This X-ray, the proper, right, with correct settings. So you can watch the orbits and orbital plate and everything is seen. Just wait.
This is head, right?
This is head, exactly. This is skull. Yes, we are talking about skull. Flatten, yes. Yeah. So this is skull. and then we inject the dye in common carotid. So from common carotid, it goes up and then it is going into the brain, right? It is going into the brain. So this is the normal image, 1, right? This is the image A. This is the image B. But these bony structures, they are coming in between. We don't want that. So this is now digital. So from B, you subtract the A. So this is done digitally, B minus A, because everything will be converted to pixels. So B minus A. So this is what you do. This is what you get. You are watching all the arteries only. So you are watching only the arteries, only the vessels, right? I would use the word vessels. Only the vessels. This technique is called as the DSA, that is the digital, because this subtraction thing that is done digitally. Subtraction angiography. So that's it for today. Thank you so much.
Thank you, sir.
Thanks a lot.
Thank you, sir.
Thank you,
And
sir.
Thank
Yes,
you,
sir.
sir.
on Saturday.
Thank you, sir.
Bye bye.
Bye, sir.
Bye,
Bye.
sir.
Bye, sir.